My assignment today is to talk about children's health. All right, so I know probably, and most of you are wondering why children's health. I was wondering about that too, because my wife and I are empty nesters right now. Our kids are on their own, and it's been a while since we had children running in the house. And I think the last time we were raising kids, they were naughty, rebellious teenagers who became young adults. So it's been a while. But then, 4 years ago, I became a grandpa. Yes. So I'm Grandpa Gene. But Grandpa Gene is not just Grandpa Gene, he's also Dr. Gene. So I'm also involved in the health of my beautiful granddaughter. So I did some research. What are the top health concerns of kids today? And I saw this and told myself, I am really out of touch. Because I look at this and I see what bullying, internet safety, those were not the concerns of the past when I was raising kids. But today they are. So, but that's not what I want to talk to you about today. So I fine-tuned my research to younger kids, the first 5 years. And then I found this. These are the top 10 diseases, health concerns of kids. Common cold, ear infection, flu, bronchitis, hand and foot and mouth disease, pink eye. You look at the list, and these diseases mean nothing to us adults, right? You get colds all the time. But for kids, most of them are lethal, can be lethal. Why? Because this will be the first 5 years of their life, the first time encountering what my granddaughter calls the germies. Viruses, bacteria, fungi, parasites, the germies. And at that age, their ability to fight back isn't fully developed yet. God has given us our own way to deal with the germies. And it's called the immune system. And this is what protects our kids and us from all these foreign objects. Now, these are foreign to our bodies, and our bodies are very sensitive to these microorganisms. They can come in, take over the cells, and wreak havoc. We just went through a pandemic. Who knew that a virus that came from the animals would migrate to human beings and cause thousands of people to die? This is real to us. And God has given us the immune system to protect us. The immune system has two main parts. One that we are born with, it's called the innate immune system, and one that we develop over time, the adaptive or acquired immune system. Now, the innate immune system is one that God gives us at the moment we're born. It is the first to respond whenever we are invaded by germs. And it's made up of your skin, the mucosa of your eyes, the respiratory lining, and even the lining of your GI tract. It's like a protective covering all over your body. And in this layer, God has given us many wonderful cells to protect us from the invasion. Now, they protect us from all these journeys. They're inherited, and they get activated the moment we are born. And so when the system recognizes an invader, they move into action. They approach that invader and try to do as much as possible to capture, destroy, eat, and do away with its invader. These are the major cells that make up the innate system. Now, over a period of time, we have the adaptive or acquired immune system. This is when your body begins to learn who the enemies are. So the first time you encounter a flu virus or a rhinovirus, you get infected. You get a cold. You go down with the flu. But then, this system will try to remember that invader. Will take a snapshot of that invader and remember that invader. So that the next time you encounter the journey will no longer be able to put you down. It will develop what we call antibodies. You generate antibodies against these invaders. So the next time you get the same infection, you are not going to get sick. That's the idea of this. It's acquired throughout the lifetime. Now, these are the cells that are involved in creating and schooling these cells. At a young age, children are born with that special organ right there, the middle of their chest, called the thymus. And scientists say the thymus is the school of the immune system. Cells pass through the thymus and they get taught on how to react to invaders. And once they graduate, they're called T cells from thymus. But after your 5th year, your 6th year, the thymus disappears. So we don't have thymus anymore. So when you take your x-ray, it's not going to show up, but kids do have it when they're young. Because that's the time when their immune system is getting schooled by the thymus. Now, the kid's immune system from birth to 6 months is all passive immunity. The kid on its own does not have anything to protect itself except for the antibodies that mommy gave to the baby during the baby's embryonic stage. Plus, through the breast milk. And this is where we preach the virtue of breastfeeding. Breast milk, the mommy's antibodies, IgA, are all passed on to the kids and protects them for the first 6 months. But 6 months and onwards, these antibodies begin to drop. Their levels begin to wane. And the child's immune system isn't ready to cope with the journeys. And that's when they're most vulnerable. Not until 3 to 4 years that their own immune system is able to protect them. That's why between 6 months to around 3 years, they get all these complaints, flu, colds, rashes, because their immune system is not fully developed. And so this is when they're most susceptible to falling into this illness. The first 5 years is what we call the golden period to strengthen the immune system of our kids. So what do we do then? Well, breastfeeding is best for kids. The breast milk contains a lot of IgA antibodies that can be passed on to the kids so they can be protected. And that's good for 6 months. After that, nutritious diet, immunization is recommended. Right? The immunization, the vaccines challenge their immune system. So they develop antibodies. They force them to develop antibodies. So we promote good GI health because most of our immune lymph nodes are in the GI tract as well. We have a lot of lymph nodes, GI tract. And of course, we try to limit as much as possible the use of antibiotics so we can promote the growth of good bacteria. Now, Cleveland Clinic also recommend that we boost the immune system of kids using supplements. I am a big promoter of vitamin C. My kids would, have sniffles. Vitamin C is my prescription of hope. Vitamin C, take tons of vitamin C. Vitamin D is also good. So where do we get vitamin D? You don't have to buy it. Okay? Ask your kids to play outside. And their skin will convert them into vitamin D. What else? Zinc from proteins is also good to fight viruses. And of course, we need to give them probiotics like yogurt to develop good GI bacteria. Prebiotics like plant fibers will also stimulate that. And then, of course, omega-3 fatty acids from fish. Do you feed your kids fish? Yeah. All right. Good. All right. Chicken McNuggets is not fish. Oh, I like fish. What kind? McDonald's. All right. Nuts, walnuts, fruits and vegetables. The green leafy ones. We've heard this, right? Your kids eat vegetables. Do they eat vegetables? You know, my grandmother loves fruits. She calls herself fruitarian. You know what that means? Yeah, I love fruits. So we need to encourage that as part of their diet. Amen? Yeah. Now, I need to talk to you about a mushroom. A kind of mushroom you probably have never heard of, or perhaps you have. And it's called Ganoderma lucidum. I've been doing research on this mushroom for maybe close to 20 years now. And we've been doing this for more than 15 years now in my department. Whoa, I just told you my age right there. Yeah, I'm only 20 years old. So we started this when I was young, 1 year old. So it's been a while. And the reason why I am doing this as a researcher, that's my job, clinical research, is because I experienced the benefits of this firsthand. My mother was diagnosed with cancer, stage 4. She was really in pain, and she was very, very, very sickly. The doctor said, there's nothing more we can do. Bring her home. Hospice care. That was what was prescribed. And palliative care. What was prescribed for my mom. I wasn't about to give up. So you know what I did? Even though I'm an MD, I went to Chinatown and asked around, what do you recommend for cancer? And I was recommended this Chinese mushroom herb called Ganoderma. In Chinatown, they call it Lingji. The Japanese calls this reishi. It's been used for more than 2,000 years. It's been called the herb of immortality. Back then, they thought that if you take the herb daily, you will never die. Now, of course, that's not true. But we found out through research that it has more than 200 biologically active compounds. A lot of medicinal properties. And it's very popular in boosting the immune system. Now, my job right now is to work in clinical research. All right, I was part of the team that helped do research in Paxlovid for COVID in the adult, and now we're doing that for the pediatric cases. So my eyes are always looking out for research on something wonderful like this. So today, with your permission, let me share 3 wonderful research papers that I found. Okay? This is a paper published in 2005, and it showed that Ganoderma, we'll just call it reishi, has huge immune-enhancing effects, extensive effects. And it's due to a carbohydrate in that mushroom called beta-D-glucan, or polysaccharide. Right? And what it does is it boosts both your innate and adaptive immune system. How does it do that? It promotes cellular growth and maturation of this so that they are ready so much faster to meet the advancing invaders. It also gives them so much ability to recognize these invaders. And if you're a macrophage, a janitor cell, eat them whole and dispense with them. And then, of course, it also enhances the ability of these B cells and T cells to multiply rapidly in the presence of an infection. So the addition of reishi helps boost our immune system. That was the research they found. The second paper I'd like to share with you is, again, about the beta-D-glucan, the polysaccharide found in this mushroom. And this one says it boosts the action of phagocytes. What are phagocytes? All right? These are cells that eat other cells. All right? So how does the white blood cell dispense with invaders? They won't flick them or hit them or jab them. They would just eat them whole. And in the belly of these phagocytes, they have lysosomes or enzymes that break them apart. And then they will extrude these raw materials for the body to use. Can you imagine recycling? This is what beta-D-glucan does. Enhances the action of the phagocytes. Also, there are compounds called triterpenoids, and they have powerful antiviral effects. One of them is protease inhibition. Now let me stop there. What is a protease inhibitor? It's a compound that prevents an enzyme to break apart proteins so that the virus cannot use them as building blocks for replication. Now, why is that important? Because that is the science behind the HIV drug right now. HIV drugs are working because they are protease inhibitors. Now listen, picking up from that science, Paxlovid, or we know this as Nirmatrelvir, is also a protease inhibitor. I can say that because I've worked with it. Do you know what the drug does? It prevents the breakdown of proteins so that the virus, COVID virus, cannot use them as building blocks for replication. Now listen, what does Ganoderma do? It is a protease inhibitor as well. So it prevents a virus from taking over your cell and replicating itself by denying it the raw materials. You know, viruses are hard to kill. We have an antibacterial because bacteria live outside the cells. So you can kill them. But viruses are inactive. They are inanimate outside the cell. They have to come inside the human cell to be alive. And once they're inside the human cell, they take over the nucleus and produce more viruses. Now, how can you kill a cell that's inside your body? That's inside your cell. All right? You cannot kill the cell to kill the virus. And that's why they either prevent the virus from coming in, prevent the virus from going out, or just deny them the building blocks. This is the science behind HIV drugs. This is the science behind Paxlovid drug. And this is the science behind Ganoderma. Now, clinical research is my field. So very early on in 2020, I found this research on Ganoderma and COVID. This was way before vaccines were developed, way before there's a drug, or before they knew there was a drug. And this was a study done, of all places, Nineveh University. Jonah hates that. Okay. So the scientists in Nineveh already knew the properties of COVID, of Ganoderma. So they got 150 subjects and divided them into 4 groups. One, of course, you always have a control group. These are people who are healthy, and these are people who are taking Ganoderma. The second one is the one with COVID positive. They're already sick, but no treatment is given. The third group is those who are COVID positive, but are only given Ganoderma for 10 days. And the last group is those that are COVID positive, but given convalescent plasma. This is blood drawn from those who have recovered from COVID. Spun, they just get the plasma where the antibodies are and give them to these patients. So that's the 4 groups. And then after that, they drew blood from these patients to find out the antibody levels. Now, for our purpose, IgG, if you see that, it means the body has already protection from the virus. IgM means you just had the virus. And you're either recently infected or recently vaccinated, but you're not protected yet. So to know if you're protected or not, you don't test IgM, you test IgG. You want to see the result? I'll show you the chart. We'll pause right here. Draw your own conclusions. Take a good look. What do you see? Control group, healthy, or those that are taking Ganoderma, there is no increase in antibodies. Of course, they're not sick. So which means Ganoderma will not induce antibodies on its own. Next group, those with COVID, IgG 2.3, not there yet, but IgM 6.2, truly infected. Those with Ganoderma, those with only, positive but with given only human plasma, healthy but given human plasma, right? A little bit of IgG, very little of IgM, not much effect. Because the person is not sick. You're just getting the plasma. Next group, patients with COVID plus Ganoderma. Look at the IgG, 5.2. IgM, 0.8. And look at the comparison. COVID plasma or COVID-19 positive with convalescent plasma. It's almost the same. Comparable. What is the conclusion here? In this research, they were showing that Ganoderma can provide antibody protection for those who are tested positive for COVID-19. This is for this time. All right? So what I want to say? Let's not get treated. But if you have it, and if you want to boost your antibody levels, IgG, Ganoderma is another way to go. So, this is my last slide. How would I recommend this to kids? For children less than a year old, we don't recommend this for kids. Not yet. They're too young. Breast milk is good for kids at this age. Right? But then for those that are a year and older, maybe 1 capsule a day just to boost their immune system. For teenagers, maybe 2 capsules a day. But if they're sick, then I would recommend double that dose. So this is the recommendation for today. Now you will learn something about Ganoderma.